Asthma is a problem in the lungs in which the lungs produce excess mucus, causing a feeling of constriction in the lungs, not allowing the person to be able to breathe properly or take deep, full breaths. There are two types of asthma, extrinsic and intrinsic. One is caused by the body's own immune system producing excess mucus and lung constriction. The other is a problem when a person breathes in cold air, breathes in a chemical agent, or exercises too much, causing restriction within the lungs. Conventional medicine treatments of asthma are typically steroidal or non-steroidal medications in inhaler form. They can be used on a daily basis to suppress symptoms or only as needed. Long-term use of steroids can cause muscle weakness, adrenal suppression, weight gain, and fluid retention. Asthma typically begins early in childhood. Some of the causative factors include genetics, secondhand smoke exposure during childhood, exposure to environmental molds, allergens, and pollutants, food sensitivities, multiple antibiotic prescriptions before the age of 1, and multiple vaccines. To diagnose a patient with asthma, I first do a medical intake of their recent symptoms. I then listen to their lungs for any abnormal sounds that indicate they were having an asthmatic attack of some sort. I also perform a blood test to assess for food sensitivities that may be irritating their condition, and I may perform a stool test to make sure that they're digesting their food properly. Asthma is a condition in which the body's immune system inappropriately responds to the environment. So my goal with treatment is to control the body's inappropriate response by introducing anti-inflammatory nutrients and removing dietary irritants. Dietary irritants include dairy, wheat, gluten-containing foods, soy, eggs, white potatoes, nightshades, red meat, and caffeinated products. So instead of eating these foods, I ask my patients to instead eat organic green vegetables, fruits, and whole grains. I also prescribe vitamin C and fish oil for their anti-inflammatory properties, magnesium to help relax smooth muscle in the bronchial airways, probiotics to support a healthy digestive system, which in turn helps support a healthy immune system. For patients with ongoing asthma attacks, I'll prescribe a botanical formula that can remove excess mucus secretion, open up the airways, and control the asthma attack. In fact, these botanicals are so powerful they can eliminate the need for an inhaler. Asthma is difficult to treat. However, when patients follow my protocol, they have a decreased number of asthma attacks, decreased severity of those attacks, and rarely do they need their inhaler.